Our job begins where most advisors stop. Saving money is great, but how do you spend it without risk in retirement? Welcome to Every Day is Saturday with Brad Gotto and Matt Stahl, partners and private wealth managers at Fiat Wealth Management. In this podcast, we aim to broaden your knowledge about the financial world we live in today and make the boring and complex financial decisions fun, informative, and educational. Join us on this journey where Brad and Matt will explore different strategies on how to spend your money without guilt and have peace of mind knowing you are spending it the optimal way in retirement.
Hello, everybody, and welcome back to another episode of Every Day is Saturday. I'm Brad Gotto. As always, I'm here with my co-host,
Matt Stahl.
Matt. You didn't know if I was going to introduce you or if you have to do it yourself, huh?
It's me today. I'm taking the reins.
Well, we're happy to have you back. Sometimes we like to have fun, but other times we really like to have fun and give timely information at the same time. And this is the time of year, Matt, where most of our clients have really one thing on their mind, and that's healthcare. Because it's that time of the year where it's time to make your decisions again when it comes to healthcare. And it's not something that we do internally here at Fiat. So not only do we have Matt and myself here, but we're actually really excited because we have a guest with us today, Allison Kraus from Shoreline. Allison, why don't you say hello?
Hello. Thanks for having me.
We're happy that you're here because this is an area that Matt and I know just about enough to be dangerous. And this is exactly what you do. And you're an expert at it. And we've enjoyed partnering with you over the last handful of years to be able to bring a lot of value to our clients. So before we jump into any content, what I'd love to do, Allison, is just have you tell our listeners exactly who you are. So why don't you tell them a little bit about yourself and then more specifically about Shoreline and what you do for your clients.
Great. Well, thank you. So Shoreline Insurance Group was born in 2014. However, I've been working health insurance and Medicare for a little over 16 years now. And so I got my start at another agency. And then right around when the Affordable Care Act came out in 2014, that's when I kind of split off on my own and started Shoreline. So Shoreline we're in Excelsior, Minnesota, independent agency. So that means we work with every insurance carrier in the state of Minnesota. And we really work with individual family, whether you are under the age of 65 or over the age of 65 on Medicare. We can help you navigate all those options, find the best solution, and help put all the pieces into place for you.
Hey, Allison, what was your background in before the insurance world?
Well, given that I started at 19, it was not a lot. If you want to count waitressing, I worked at an apple orchard. There was a store at Mall of America that I ran for a couple of years, which was super fun, just handing out apples, which is ironic because I hated everything about apples until I started working there.
So do you like apples now?
Now I like certain kinds of apples.
Okay.
Yeah. But really...
Now she hates health insurance.
Yeah. Time to move on.
No, health insurance was like my first and only real career decision. So thank God it stuck.
Well, a lot of changes, obviously, in the healthcare space since you got into it. And then since you started your own firm back in 2014. One of the reasons that Matt and I love working with you so much is because of what you mentioned before. And I want to make sure that the listeners heard it and kind of internalized it. And that is that you're independent and you can work with any of the providers here in the state of Minnesota, which of course is great for your clients, but also important to note that it doesn't matter if they do business through you or anybody else, or they find it on their own. The plans are the plans, right? And so adding you to their life for all intents and purposes adds an expert, but that doesn't add any expense. Is that true?
Absolutely. Yep. You could do everything on your own. And actually, you might wind up on the same plan I would recommend. But the difference is you might, doing it on your own, always wonder if you made the right choice. Sure. And if you work with an expert, you know that you're on the right plan for you. So that's the difference. And it doesn't cost you anything.
Yeah. It's just one of those rare times in life, and life expert to your life literally costs nothing.
Nothing.
It's hard to make an argument why you wouldn't use an Allison or a Shoreline, to help you make these decisions, especially in such what can be a very complex world, and quite frankly, a very expensive world, healthcare.
Absolutely.
And if you think about it, most people are making this decision maybe once a year, but often it's one time and then they let it go. So if you're only doing this one time, It's very different than if you're doing it every single day, and up on the changes. It's a tough thing to tackle. And then you're having conversations with friends and you can very easily get wound up, because you don't know how that applies to you. Right. So that's where we can kind of come in and just streamline it. So.
Cool. So Allison, selfishly, I've been going out and finding my own health insurance since 2009 now. So that'll be coming up on 12 years. And most of the people we run into as we're digging into the financial planning, it's either post 65 and it's Medicare, and that's one route. We also run into a lot of people that have the ability to retire pre 65. And one big point that always comes down to is, well, what about the health insurance? We're not 65 yet. We're not up to Medicare. And just based on my own personal experience on how confusing that world can be, can you just walk us through? So say I'm 55 and I'm deciding to retire right now. And that's something that's on my mind. I come to your office. What does that conversation look like?
Yep. Well, it's a very different conversation from 2009 than it is today, and every year in between. So the Affordable Care Act, the ACA, really went into full effect in 2014. Okay. And in Minnesota, just a little history, we had the lowest cost plans nationwide.
Why was that? Is there any reason behind that, or?
Not that I'm aware of. I know that every carrier came to the Department of Commerce with their plan offerings, and they all have their own legal, and they're trying to read these laws and put together their plan portfolio, but you can't look, at what the other carrier is doing, right? So they submit to the best that they can. And ultimately we had one carrier that took on almost 80% of the market share.
Holy cow.
So, and we had the lowest cost plans. But what a lot of people also don't realize is prior to the ACA in Minnesota, we had a guaranteed plan. It was called the Minnesota Comprehensive Health Association, which was essentially coverage for anybody who was uninsurable or would be turned down through a private insurance carrier. So we had essentially ACA prior to the ACA. Right. But in 2014, we have a surplus of new options and the rates were really good year one. So what happened? You have a lot of people in this high risk pool that are definite users of healthcare, and they're flooding into the individual market. Right. So we have 1 year where we have platinum plans, super low premiums, and ultimately year two, 2015, we saw rate increases that were on average 30 to 60%.
Holy cow.
Wow.
Yep. So fast forward to 2016, we have 5 carriers in Minnesota, and one of them, Blue Cross, had 2 licenses, and they terminated one of those licenses, which effectively canceled about 103,000 members. So that changed everything. So now every insurance carrier that already filed rates went back to the Department of Commerce and said, whoa. What we previously submitted, we're going to have to revise this. And so for the first time ever, we saw carriers pull out of certain counties in the state. So they shrunk their service area. They pulled out of having open access networks. Now we have private carriers and select care systems, right? So where you do your doctoring is going to drive which carriers we should be looking at for you today. Before we had open access, you can kind of go wherever you want to go. So that changed. We have enrollment caps where insurance carriers said, we're only going to take up to X for the first time ever. So it's kind of like claim your spot. Or if you have a spot, maybe don't give it up until you know what you've got going. The rates obviously went up, and then they scaled back their plan portfolios, and they scaled back a lot of the ancillary benefits that we were used to. So the game has changed quite a bit, even from 2009, fast forward to where we are, right? So now if you're under the age of 65, I would say we've seen a lot of stability probably in the last 2-3 years. And that's largely due to our Minnesota legislators and pushing through reinsurance for one, that's helping to reduce the cost for health insurance on the private market. So that's helping quite a bit, but we still have a very different portfolio of plans to choose from. And one thing that hasn't changed is the doctor provider networks. So people who are retiring early, that may be of concern, depending on where you live and the doctors that you're looking to keep, such as Mayo. From a cost perspective, I would say that the individual private market is not as bad as what some group rates would look like. So if you're leaving, you have the option for Cobra that's usually going to be more expensive, not 100% of the time, but usually more expensive than what you would find within a private market plan. So you just have to kind of weigh out what's the coverage that you have and how important that is for cost comparatively to the private market and some of the things that you might be giving up.
You know what I got out of all that, Matt?
What's that?
It's a good thing we have Allison.
Yeah, I was going to say exactly. I just learned a bunch of stuff. Right?
Holy moly!
It is fascinating to hear about the history. Like I didn't know any of that.
Yeah. Well, and there's a lot of pitfalls in there when you're talking around doctoring, and what I got out of it is the answer or solution is going to be very specific to a person.
Yes.
Right, and that whatever coverage that they find needs to be make sure that it fits whatever needs that they and their family have. And I would say, Matt, see if you agree with this, the number one reason that people do not retire before the age of 65 is because of healthcare.
Absolutely.
They're trying to maintain coverage through an employer.
Yep.
They think it's going to be too expensive if they leave their employer. They don't understand the coverage. They think that whatever they have through their employers going to be the best possible coverage they could get, and can't get that kind of coverage privately. Right. There's a lot of unknowns around healthcare, and that's, I would say, the number one driver for people, hanging in there those last couple of years.
Yeah, well, I'd say the unknown of the healthcare, as you just said in two separate sentences, because once they have the conversation, oftentimes, if we send them over to Allison, just being able to put their finger on this is how much it would cost, sometimes brings the peace of mind as opposed to just the unknown. So
I would say that that's very true. Very true.
Yeah.
That a lot of people come in and they've actually made it way worse in their head than what's actually right, the reality. So it's kind of a sigh of relief for a lot of people. Yeah. But you're right. They're kind of stuck, or they assume that whatever they have while they're working has to be better.
Yeah. Allison, so when you say ACA, is that the same thing as MNsure for the folks here in Minnesota?
That's a good question. The ACA is the law. That's the law that dictates the health plans. So the ACA, there's a few things. One, every health plan must have 10 minimum essential health benefits. That's number one.
Okay.
Two, they're guaranteed issue, meaning you're not asked a health question, you can't be turned down. Three, the insurance plans can't have a pre-existing limitation. So assuming you're eligible to sign up, whether it's in open enrollment or you have a qualifying event, you're not going to have a pre-X limitation. It's going to be covered for whatever your scenario is from day one. Okay. So those are pretty big things with the ACA. MNsure is our state exchange. So the best way I can describe it, think of it like a Travelocity. Right. So on Travelocity, you're going out, you're shopping for flights, but you're not seeing 100% of the flights. Right.
Yep.
And if you buy your ticket through Travelocity, you're not flying Travelocity, you're flying Delta. Right. So MNsure, similarly, you're going to go out there, you're going to shop and compare health plans, but you're not seeing 100% of the private market plans.
Got it.
But ultimately, if you sign up for a health plan through MNsure, you're flying Blue Cross or UCare or Health Partners. So all of your claims and whatever related to your health plan is really with an insurance carrier. So MNsure is not a negotiating table. They're not an insurer. They are primarily a delivery system for federal subsidies.
Got it.
And Minnesota just made the call at the get-go to have a state exchange. So many other states operate on the federal exchange, healthcare.gov. So there's several other states that have a state exchange. MNsure, Minnesota is one of them. So it's quite confusing because most people just assume I have to go through MNsure, but you're not buying a MNsure health plan. You're going through MNsure primarily for financial assistance because that's the only way that you're going to see a reduction in premium costs for your private market plan.
Got it. Okay. So if I'm in a state that does not have their own exchange, I'm going through the federal website. Is that
healthcare.gov?
Okay.
Yep.
Got it.
And so to kill your analogy off here, of Travelocity real quick, to make sure that I understand and the listeners understand. Yeah. So when you go out to MNsure, that's shopping the plans for you, like Travelocity would a flight. It's going to kick back whatever options there are. Of course, you're going to end up buying that flight from whatever airline makes the most sense for your situation. Similarly, you mentioned a couple of insurance carriers, or Blue Cross or UCare, whoever it may be. Yep. But you also made a comment there that it doesn't shop everything.
Correct. Correct.
Why would it not? What's the...
Yeah. So we have some carriers that have opted not to participate on the exchange. So for instance, Preferred One, they were originally with MNsure. And then after that first year with the lowest cost plan in the nation, they've decided that it was too much work. So they pulled back, and so they are still in the private market, but the only way you would have a Preferred One plan is going direct, which is fine for some people. If you're not qualified for financial assistance, that might be a great solution. So MNsure is kind of, you are adding in an extra element to your health plan. So any changes that exist have to be done at the MNsure level. You can't just call up your carrier. And kind of like Travelocity, you might feel like you're getting bounced around a little bit.
Yeah.
So it's maybe not been the most easy to deal with, but I would say, and I have to give them credit, it's gotten a lot better since 2014. But if you talk to somebody who, started out the first 3 years, it was a nightmare. It felt like you were operating on DOS. So
I jumped on the first year just for the heck of it, just so I understood. Take a guess at how many times it took to actually get through just the initial page.
I would guess 50.
No, I was only 19.
Oh, okay.
So, yeah. It's still a lot.
It was insane. And thankfully, I mean, the thing is with the federal subsidies, we can go back to that a little bit. So MNsure, primarily you're going there for financial assistance, right? Mm-hmm. Financial assistance, they're looking at a few different factors. Number one would be income. And then it's how old are you? Where do you live? What plans are available? And ultimately, is it affordable for you? And that's kind of that wild card that we don't know because they're federal subsidies, but we have state, right? So the national average for what they deem affordable, we wouldn't necessarily know that. So you have to go out to MNsure and put in all of these key factors, and then they're going to come back and say yes or no. But initially, there's an income. We can talk a little bit about what's going on shortly, but prior to this year, you had to be within a certain threshold with your income. And if you're above that cap, you don't get anything, from the federal subsidies.
Yeah.
Well, now that cap is lifted, but going back to how it was, if you were potentially within that income threshold, but then looking at the lower cost health plans that we had here in Minnesota, a lot of people were applying for MNsure going, I don't get it. Yep. My income's in the threshold, but then they're looking at the cost for insurance here in Minnesota and they're like, yeah, no, you don't qualify. So
the really interesting thing, Brad, we've experienced this with folks that have transitioned to retirement. A lot of their income isn't necessarily hitting their tax return. So we've run into scenarios where it seems like they would get a subsidy in a scenario when we would think they would not. I mean, these people have assets. It's just, they're deciding to pull from different areas that those particular streams of income are not hitting their tax return. And that's just kind of mind boggling, but super interesting.
Yeah. It has nothing to do with your net worth, right? It has everything to do with what your 1040 looks like at the end of the year. And so we have, I think of a specific case in my head of a client that lives on 6 figures of income every year in retirement and received a very significant year to the point where his premiums are almost nothing. So it's still relative to your taxes. But before we transition to Medicare, Allison, I just want to kind of sum up this whole pre-65 individual coverage conversation. A couple key points I want to make sure that the listeners pull from this, and that is, one, it's not as bad as you think. It could be the very thing retiring, this fear around healthcare and the costs associated and not thinking you can afford it, that in fact could potentially be quite affordable, and the coverage could be just as good, if not better, than what you have through your employer. And for the people that are thinking about retiring and using COBRA or the extension of their group benefits after they leave employment, a lot of times what they can get on the individual market is going to be possibly better than that. And last but not least, you can use a healthcare specialist literally no cost. So figuring all this stuff out and trying to answer one of the biggest unknowns for retirees and one of the largest expenses for retirees around healthcare literally costs you nothing. Did I miss anything?
No, the perfect summary. You take great notes.
Yeah, Of all the people, Allison, that these strategic partnerships that we have to make sure that our clients are well taken care of in the areas where Matt and I just don't specialize, this one to me seems like the biggest no-brainer for anybody, whether
Absolutely.
they're a prospective client of Fiat or not, or you found this podcast randomly and you don't even know who Fiat is. If you've got healthcare questions, you should be talking to Shoreline to get this together. With that said, though, I do want to transition a little bit because we are coming up on open enrollment season for Medicare, and in the state of Minnesota, that happens to coincide with when everybody wants to go hunting, and so we got to get all these decisions made before hunting season opens up and make sure we're set for the year. So, with that said, Allison, tell us what open enrollment means and kind of what the dates are, and kind of give us the timeline of what's coming for people on Medicare.
Open enrollment for Medicare is October 15th through December 7th every year. And actually, for the private market, it's kind of running at the same time, just slightly different dates, November 1st through December 15th for the individual sub 65. So going back to Medicare, every year, October 15th through December 7th, this is your opportunity to review your plan and make any changes or sign up if you don't have a supplemental plan, but you already have Medicare Part A and B.
Gotcha. So you made an important distinction there, whether you've been, this is second year or beyond of you being on Medicare, but you also made a distinction for people signing up for the very first time. And I think that can be a pretty daunting thought because you've never been on Medicare. You don't really understand what it's all about. So can you speak real briefly to the process of signing on for Medicare in the first year and what that all entails?
Yep. So I start every client call when we're talking about Medicare. I have to just ease the concern right out the gate. Medicare's fabulous coverage. It's fabulous coverage and frankly would trump every commercial market plan. And the reason I say that is kind of twofold. One, cost. The standard monthly premium for 2021 is $148.50 a month. Granted, this is income related, but this is a standard amount that everybody's going to pay. If I'm comparing that to a commercial market plan for somebody 65 or older, that's significantly less. Most people are paying $600 to $1,500. So cost is one reason why I say Medicare is fabulous, but it's really the coverage. So Part A is hospital. Part B is medical. Part B is all the other stuff where you're not in the hospital, it's not a prescription, right? So Part B, you have a deductible of $203. Again, comparing to a commercial market plan, people see deductibles of $7,000. I'm like, $203, sign me up. And then Medicare is going to kick in 80% for all of those Part B services, doctor's visits, outpatient, ER. But this is where it gets really good. Why I say Medicare is fabulous is because of the payment rate. So the payment rate is what doctors get paid to treat someone having Medicare versus having any other commercial market plan. The payment rate for Medicare is on average 87% less. So think of it this way, before adding in a supplemental plan, before you add in supplemental insurance, right? You have only Part A and B and you go in for all kinds of care. Your responsibility is 20% of a bill that's essentially 90% off. That's why Medicare is fabulous. So for a lot of people, as we're having this conversation, the question becomes, why then do we bother with supplemental insurance? And how do I choose is kind of the follow-up. But the real reason why you still need to have something is because Medicare on its own does not provide you a maximum out-of-pocket limit. So there's no cap to that 20%. You need to know that if you hit X, now insurance is going to pay 100%. And without supplemental, you don't have that worst case scenario. So that's truly why you're going to choose supplemental insurance. And that's where we come in is kind of help you navigate all of those plans. But Medicare's fabulous.
Oh my gosh, I had no idea.
Yep.
Yeah. So
crazy.
not all 20% deductibles are created equal. 20% of a bill that's 87% cheaper is a little bit better. Better.
Yep.
So they're in their first year, right? And so in that very first year, obviously cost, which we've spent a lot of time on here, is important to understand. But what about just the process in general? Any kind of big things that people need to know, mistakes people make, or just kind of the general process of getting registered and signed up for Medicare?
I would say easiest way to sign up is online. Medicare.gov. Some of the big mistakes maybe some people make, if you plan to continue working and you assume that what you have through your employer is better, it's definitely worth a second look. But a lot of people do just assume, and they waive Medicare, and they shouldn't, because Medicare has fabulous coverage. So that's a mistake that I do see often. And then I guess the other thing too, it depends who you talk to, but a lot of people sign up for Part A right out the gate because they're talking to friends and that's what they were told to do. And that's okay. You can have Part A, your hospital benefit. There's no premium, and truly it's secondary to an employer plan. So you didn't make a mistake by having it unless you have an HSA qualified plan and you want to make HSA contributions. So a lot of people make the mistake of having Part A, but they are still making contributions to a health savings account while they're working. So outside of that, navigating the sign-up process, pretty simple to do if you're new to Medicare and you know you want it to start right around age 65. It's when you delay, people will get kind of caught up in some of those details, and everybody's situation's a little bit different. So there's a lot of gotchas in Medicare. And that's where I say, if you're talking to one friend, you might get one answer. And it's really how you apply that to your own situation. You could do a lot of reading to try and figure it out, or you could just call us.
Yeah, I think it's worth noting here at this point in the podcast that obviously Medicare can be daunting, confusing. It can cause people to freeze, paralysis by overanalysis. Bottom line is you need healthcare coverage. And at 65, the government provided coverage that you've been paying for your entire life, Part A, and then the premiums for Part B and then Part D. There's multiple parts to it, what they cover, how much they cover. That stuff is just, it's so hard to internalize all of it and remember all of it. The bottom line is when you pick up all three parts, A, B, and D, and then you buy a supplemental policy, Allison, like you were mentioning before, to kind of make sure you have a max out of pocket with a high level of certainty, not guarantees, but with a high level of certainty, you can kind of plan on a financial worst case scenario and just kind of start baking in what your healthcare costs should be each and every year. In fact, Allison, you and I were just doing this a week or two ago for a client that I was doing some planning for. So can you talk a little bit about that for people? Like if you have kind of max coverage, right? You're signed up for Medicare, you get all three parts, A, B, and D, and then you've got a supplemental plan. Kind of walk me through the expected annual expense with premiums, out of pockets, all that stuff that people should kind of plan for.
Sure. So Part A, no cost. Part B is that $148.50. If you're a higher income earner, you get to pay more than everybody else. And if you want to know, you can Google IRMAA, IRMAA brackets for this year, and it'll pull it up. So $148.50 is kind of your standard. And then it's whatever you add in for supplemental. So and I kind of look at anything coming out of your pocket needs to be accounted for. So if it's premium dollars, that's your out of pocket, right? Or it might be a mixture of premium and co-pays. But always you're going to have so it's kind of how you're going to spend dollars. So if you want to go to the max extreme in terms of how much you're spending in premiums and eliminate all co-pays, cost sharing for hospital medical expenses, you could figure in today's numbers right around $230 for a supplement
per month.
And then you're going to need per month. Yep.
Per person, right? Per
person. Everything in Medicare is per person, by the way. You can't have a family plan or bundle anything together. So it's an individual decision. Yep. So $230 for a supplement, and that's going to eliminate your out-of-pocket expenses down to zero. So the only other out-of-pocket is prescription drug, which you're going to have premium and then out-of-pocket expenses if you have actual prescriptions to take. So premiums, I would say they can range. A standard premium figure $30. But they could be as low as $7. They could be as high as $100 in premiums per month. And then this is kind of the kicker. When you get into Medicare, the one thing that you can't buy that's going to provide you a maximum out of pocket is a Part D prescription drug plan. All Part D plans, you're going to have skin in the game when it comes to drug co-pays. And the reality is, if you needed some really expensive medications, knock on wood, that's not you. But if you do, and let's say it's $1,000 a month medication, ultimately you're going to be in what's called the donut hole. And then you're going to be in what's called the catastrophic phase. And that probably happened around month 4 or 5. And when you hit catastrophic level with every Part D plan, you're still paying 5% on those high cost specialty medications. So the takeaway for you guys and anybody listening is really on Part D or prescription drug costs, there isn't really a good way to put a max cap or a budget. You don't know which medications you're going to need. I don't come across it very often, but I certainly do because that's what we do every day, right? But I would say there are a lot of common prescriptions that are not very expensive, or they're going to be covered at 100% depending on your prescription. But if you were one of those people that requires specialty, it's kind of hard to put a number to it because you don't know what those drug costs are. And that, frankly, when you go back to the ACA, there's a ton of rules on insurance carriers, on providers. There's not a whole lot on pharmaceuticals. So if you talk to insurance carriers, that's what's driving premiums, primarily. So when you get into Medicare, this is probably the only area where I'd say not as fabulous, but everything else, fabulous. So going back to the numbers, $148.50 Part B, $231 for a supplement if you want zero out of pocket, prescription drug premium, figure $30 just to be on the safe side, and then whatever your drug costs are, which might be zero, or it could be potentially 5% once you hit that catastrophic level, which is this year around $6,550. So the wild card is going to be your Part D.
So if you're Cadillacing it out, kind of what you're talking about, you want to make sure that everything's a known. The only thing that you can't have complete control over is prescription drugs. But outside of that, you're all in with Medicare and your supplements for right around $400 a month per person.
You got it.
Roughly.
Yep.
So $4,800 a year on a per person basis. If you basically just want the best of the best, don't ever want to walk into a hospital and get any sort of bill or copay. Again, with the only exception to that being any prescription drugs that might come out and some copays there.
Mm-hmm.
If I was a retiree, that would actually make me feel really good.
Yep.
Mm-hmm. I like the known, especially with expensive as hospitals can get. I have a woman. When you have 2 boys, sometimes you end up in the hospital. It just is what it is. And I just cannot believe what hospital bills are these days. In fact, the last bill I got, my son had to take some Advil while he was at the hospital, and that Advil cost $85.
Oh my gosh.
Jeez. Yeah. Tiny bit of a markup there. That's worse than the airport. So it's just nice to know. A little delay there, but I'm glad you laughed at my joke, because this healthcare stuff is really serious and it can be very, very high. But at the end of the day, this is really important stuff. And for people to understand in retirement, control is everything, right? In retirement, people are just always looking to gain more control over the unknowns because it's scary, right? You're done working, so you don't have a check coming in the door necessarily every month or every 2 weeks or whatever it may be. And so the unknowns of the stock markets, healthcare costs, all that kind of stuff is just it's a daunting thought. So I actually think it's nice to know that you can get to a spot where there isn't a lot of unknown when it comes to healthcare. And quite frankly, the costs aren't, when you think about what you pay in a W-2 job for a group health plan every single month, there's a lot of cases where I think it's actually cheaper. What we just got done describing is cheaper than what they were paying through their employer.
Oh, for sure. We've eliminated deductibles. I mean, it's all wrapped into a premium that for most people is less than what they're paying in premiums. And we've eliminated high deductibles. So,
or if you have a family of 6 and you're self-employed, then, that's a whole nother category.
A little different.
That was your decision, Matt. Allison, anything we didn't cover that we should have covered that other people should know? When I go back to the timeline, I guess I'm going to answer the question myself at first, because you said October 15th through December 7th. I would assume you don't want people calling you on December 7th and trying to get in. So what's the process that people, the timeline they should put in their head of trying to take it's coming?
Well, We love stragglers, so that's fine. Call us on December 7th. Most of our clients, though, are actually,
Okay.
but most of our clients, honestly, are planners. And so they actually want the appointments on October 1st when we can start talking. We can't even take an application, but they still want to talk about it, which is totally fine. So, the deadlines are what they are, and we're using every day of that to make sure we get to everybody. But as far as what to expect, I would say for 2022, I don't see, at least in the Medicare world, we're going to see a whole lot of change, which is great. Nobody likes change. But I would say some of the changes are actually enhancements when you get into the Medicare world. Sometimes you see premiums go down. Sometimes we see copays get lowered and added in extra benefits. So change can actually be a welcome thing in the Medicare world. Usually not so much on the under 65 marketplace. So that's where I would expect that we're probably going to see some changes for this coming year. So on the horizon, we've had what's called reinsurance in place since 2017. This is specific for Minnesota. And it just got passed for one more year. So I don't know what's going to happen after 2022, but ultimately reinsurance is helping reduce premiums on average 20-25% every year. And so thankfully that got approved for yet another year. So that's helping anybody who's maybe not eligible for a subsidy, just kind of keeping the overall cost for health insurance less. But the other thing that happened earlier this year, President Biden passed a American Rescue Plan Act. And ultimately, it lifted that income threshold for people to be eligible for a tax credit. So people who may not have been within that threshold before potentially may qualify for help now, but you can only get a tax credit by going through MNsure and submitting a financial assistance application. But the other thing the American Rescue Plan did is it's capping the cost for insurance at 8.5% of your income. So this is important because if you think about employers, if you are a large employer, you have to provide affordable healthcare. And in order for it to be considered affordable, it's right around 10% of an employee's income. And it's the employee-only income. So now we're talking about federal subsidies for private market plans, and it's 8.5% of the household income. That's pretty significant.
Yeah.
Right. So people who kind of fell outside of that window might actually want to go back to MNsure and qualify for financial assistance and maybe change up what they're doing. They might keep their same plan even, but just buy it through MNsure versus off exchange. So I think a lot of our conversations this year would be for the under 65 on that level. For Medicare, I mean, it's always a good idea to shop just because, well, frankly, health insurance, you're not earning brownie points. It's not like State Farm where they're going to give you a discount just by staying with them for 5 years. So it's a good idea to review and reassess your plans because there might be something out there that's just giving you a little bit more bang for the buck. But ultimately, there's not a ton of change in Medicare. So it's just a good idea to review and make sure your doctors are still in network, your drugs are all still covered, and you're getting everything out of your plan that you could be and should be. And that's what we help with.
Awesome.
That's awesome. Anything else, Matt, before we let Allison back onto her day?
No, once again, Allison, I learned even more things.
Good.
I appreciate it.
You're even more dangerous.
And I learned even more why it's so important that we have a relationship with you.
I love it.
Allison, how do our listeners get a hold of you if they want to get a hold of you?
Best way, well, we have two methods, actually. You can email or call. Email is ak@shorelineinsurancegroup.com. So long, but simple. The other way, just to get started, is to go to our website, shorelineinsurancegroup.com. Right on the main page, there's a tab and it says request a quote. That's really everything we need to get the ball rolling, send plan recommendations, send calendar invites so we can have a chat and get everything going. So if you want to start there, do that. Otherwise, we can start with a simple phone call and working from there.
Awesome. And if you have a relationship with Fiat, we're more than happy to get you in contact with Allison. If that's easier for those of you that are listening that want to get in contact with her, we're more than happy to put you in touch with her and her group as well. Allison, thank you so much for being here. I know that this time of year gets really, really busy for you. And so we appreciate you taking the time, educating our listeners a little bit more on what to expect when it comes to healthcare. It was very informative.
Awesome. Well, thanks for the invite. This was a treat. So thank you.
Thank you, Allison.
As always, guys, thank you so much for listening to Every Day is Saturday. And if you want to reach out to us at Fiat, our website will provide all of the information that you need. And you can find us at www.fiatwm.com. If you have not already, please subscribe to the podcast. And we don't want you to miss an episode. And we would also love it if you would share it with your friends and your loved ones. As always, I'm Brad Gotto, and this is my partner,
Matt Stahl.
And we'll see you guys next Saturday.
But Brad, we don't record the podcast on Saturday.
Eventually, Matt, you're going to figure this out. Every day is Saturday.
Yes.
Thank you for listening to Every Day is Saturday. Click the subscribe button below to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Fiat Wealth Management or Foundation's investment advisors. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning.